Alpha Day, this is Congressman Michael Nicholas. Our veterans deserve the best, and I'm working hard to make sure they receive what they earned defending our freedom. If you need help receiving the benefits you earned from the VA or the Defense Department, please call my office at 475-6453 or go online at stnicholas.house.gov. On behalf of a grateful community, thank you for your service.
This ad was paid for with official funds from the office of Congressman Michael Nicholas.
Alpha Day, this is Congressman Michael Nicholas. Our veterans deserve the best, and I'm working hard to make sure they receive what they earned defending our freedom. If you need help receiving the benefits you earned from the VA or the Defense Department, please call my office at 475-6453 or go online at stnicholas.house.gov. On behalf of a grateful community, thank you for your service.
This ad was paid for with official funds from the office of Congressman Michael Nicholas.
Funerals actually take a lot more planning than I expected. With us using island cuisine for the first time, of course we were iffy, but once they came and showed us their service, their food, we tasted their food and everything, we definitely use them again because their service and food is just awesome.
After Guam, si Rod's Gripab introducing the 2020 Toyota Tacoma Access Cap TMAX. Este na mes, kung mo yung promo United Airlines, $1,000 United vouchers. After nananga, sabik man manono si Tacoma, Guam, Tacoma territory. Text si Rod's, ginagi Atkins Pro Toyota, 671-788-2584. Alumbray, go si Rod's, sinanagan sa 671-788-2584. After nananga, let's go places.
Good morning, Micronesia. I'm Troy Torres, and welcome to Kandit News to our studios here in Tumon, Guam. It is Monday, March 16, and we in Guam woke up this morning, if you didn't hear the news last night, to being the first island of Micronesia to have confirmed COVID cases. 3 confirmed so far. There is information that the government of Guam late last night around 1 a.m. or 2 a.m. had to update because as previously reported, and the governor admits that, this is a fast changing situation, and as they continue their investigations, they might get some information wrong, and so they corrected that information. Last night, Governor Lulianguro reported that there were 3 COVID-19 cases of 3 people over the age of 60. 2 of them, she reported, came off the plane, a United Airlines plane on Monday, March 2nd, from Manila. They've since updated that information after continuing their investigation of those two patients and found out that no, it wasn't a March 2nd flight from Manila, it was a February 29 flight from Manila. That was Saturday morning. So the governor's request to anyone who was on that flight now stands. If you are one of those people, please call your physician right away and self-quarantine, and you'll get your whatever your marching orders are, or the recommendations that you need to take by your physician. Now, without further ado, we bring you the governor's address, which she released around 2 a.m. last night with more information, new information. If you're from the government of Guam, if you're an employee of the government of Guam and non-critical essential services, stay home. The government of Guam is closed for the next 2 weeks, except for essential services. Public schools closed until further notice. And without further ado, here's the governor's address. Oh, I didn't have my microphone, huh?
Good morning. Last night, I announced that we received our first confirmed cases of COVID-19. Each of these 3 patients presented to GMH on Saturday and were isolated pending the outcome of their respective test results. Each patient remains in isolation, and Public Health has since initiated its close contact and tracing investigation. Because I want to give public health officials and our CDC advisors the best chance at investigating and mitigating against the spread of COVID-19, I am ordering a 14-day suspension of all non-essential government services effective immediately. All critical health and public safety operations will continue uninterrupted. This 14-day shutdown includes schools and all other government agencies. Directors will advise government employees if they are required to report for essential government operations. While our public health officials are doing their job to detect and track any potential spread of COVID-19, I am asking that we, as a community, take actions to make that task easier. We can do this by taking steps to prevent further transmission. By now, you have likely heard the term social distancing quite a bit. This practice includes maintaining a distance of between 6 and 10 feet from the next person when you are out in public. Please practice social distancing. It is imperative to our community's health. Additionally, on the recommendation of CDC and local public health officials, I am prohibiting large gatherings of 100 people or more. This prohibition includes social, school, sports, and religious gatherings. Detailed guidance on this prohibition will be provided in the next few hours. I know that many of you have questions. Shortly, the Joint Information Center will be announcing the establishment of a hotline intended to address your concerns as best we can. Additionally, other guidance as it becomes available will be provided by the Joint Information Center. I do not take this action lightly. I do it knowing that it will temporarily but significantly affect our way of life. But protecting you and your families is my first responsibility. I know that many of you feel a sense of fear, but you are our most effective weapon against this virus. Equip yourself with information. Stay home if you are sick. Avoid close contact with those who are ill. If you need to go to the grocery store, the pharmacy, or a medical facility, do that. But know that limiting your contact with those who might be ill is how you can help the doctors, nurses, and first responders who are keeping us safe. As I have said in the past, the situation is developing in real time. We share the information we have as quickly and accurately as we can. But sometimes that information may change as details are investigated and verified. For example, after further vetting and investigation, we have determined that 2 of the individuals who have received positive COVID-19 results actually arrived on Guam on February 29 and not March 2nd as previously reported. We are in the midst of a global challenge. Many countries around the world, 49 states and the District of Columbia, all have confirmed COVID cases. We are not alone, and I am taking these actions now to protect our community as a whole.
That's Governor Lulian Guerrero. At around 2 a.m., at around 3 a.m., or at 3 a.m., the Joint Information Center released the following information.
Breaking news tonight, President Trump declaring the
The governor, in consultation with public health and the CDC, has implemented a 14-day suspension of non-essential government of Guam operations effective today, March 16. All critical health and public safety operations will continue uninterrupted. Directors will advise employees if they are required to report for essential government operations. There is, if you are wondering about overtime pay or anything like that, none of that information is spelled out, and I'm sure that as the hours go on in today, something like that will be ironed out. The 2-week suspension of non-essential government operations is intended to give public health officials, as the governor said, and the CDC advisors the best chance of investigating and mitigating the spread of COVID-19. They're trying to stop the transmission throughout the community, and one of the ways to do that is to stop large gatherings of people like Government of Guam workers pooling inside Government of Guam agencies from transmitting the disease. Upon confirmation of 3 positive results, Public Health and Customs have revised information previously reported to the public. This is how the governor was talking about how that United Airlines flight from Manila with the 2 out of the 3 cases came in on February 29 and not March 2nd. Now here's what's closed. Department of Education schools are closed until further notice. For the University of Guam, all on-campus classes are canceled until further notice. All online classes resume normal operations. For Guam Community College, the college assembly scheduled for March has been canceled until further notice. The campus will remain closed to the public until classes resume at 4 p.m. on Monday. There's no date here. It doesn't say March 16 or March 23, but they say further guidance will be issued if there are changes. St. Paul Christian School is closed until further notice. Guam Adventist Academy closed until further notice. Mount Carmel School closed from March 16 through March 18. We got information last night that St. John's School is closed until further notice. And as soon as, I don't know if Mass happened this morning at 6:30 with Pali Mike, because as you heard the governor say that religious gatherings are included in the mandatory ban for gatherings of 100 people or more. Normally the morning masses throughout the diocese are not filled with 100 people or more. So I don't know if Pali Mike Crisostomo is available to take our phone call, because there's normally a 6:30 Mass, but maybe around 7 o'clock. We'll give him a call to see what's going on with the rest of the Catholic schools. The governor is meeting with school officials today to discuss further guidance. Here's what they're asking for those who were on that February 29 flight. For those in the community who returned from the Philippines on February 29 and have flu-like symptoms, they are advised to stay home and contact your doctor for further guidance. If you recently returned from travel off-island, stay at home and avoid contact with others. Do not go to school or work for 14 days. Discuss your work situation with your employer before returning to work. Seriously consider canceling non-essential travel. Additional guidance regarding all resident travelers will also be provided. For senior centers, they will be closed beginning today. As a precautionary measure, all individuals who have frequented a senior center in the last 14 days are asked to stay home and contact a doctor should flu-like symptoms present themselves. This is very important because this affects a lot of people. I'll repeat that. As a precautionary measure, all people who have frequented a senior center in the last 14 days are asked to stay home and contact a doctor should flu-like symptoms present themselves. They're not saying why, but there's a reason why this is being highlighted as information for people to know about. The governor's office and Guam Homeland Security are asking that you adjust your lifestyle now that COVID-19 is on Guam. They say, although daily life must resume, the community is advised to take personal measures to help stop the spread of the disease. In an effort to stop the spread, CDC is encouraging social distancing. This is the whole don't be near people thing. Take extra measures to put distance between yourself and others to further reduce your risk of being exposed to this new virus. Social distancing includes avoiding high fives, shaking hands, hugs, or close contact with others. Take precautions now. It is currently flu and respiratory disease season, and the CDC recommends getting a flu vaccine, taking everyday preventive actions to help stop the spread of germs, and taking flu antivirals if prescribed. Wash your hands often with soap and water for at least 20 seconds. However, if soap and water are not readily available, use alcohol-based sanitizer. There you go. That contains at least 60% alcohol. Oh, this doesn't say. 62% ethyl alcohol. We're good. Do not touch your mouth, eyes, and nose with unwashed hands. Now, that's probably the most difficult thing to do. Because I have I have this compulsion where if I touch one side of my nose, I have to touch the other side of my nose. Or if I rub one eye, I have to rub the other eye. It's crazy. See, I just did it. Son of a gun. Do not come in contact with people who are sick. Good enough. Practice proper cough etiquette. Cover your mouth and nose with a tissue, then throw the tissue in the trash or cough into your sleeve if tissue is not available. So this is another difficult thing to do for people who are in the habit of coughing into their hands or covering their mouth when they sneeze like this. Well, that sucks for you and for everybody else because you've just contaminated your hands and you're gonna touch things. So
into my shirt.
Yeah, so the proper way to sneeze, I learned this a long time ago. I think it was during their avian flu or something, is to cough into your sleeve like this. And if I had abs, I would lift up my shirt and cough into my shirt just to be a show off, but I don't.
That's what I do.
I've never had abs. I've always had flabs. Call your doctor if experiencing COVID-19 symptoms. Okay, so this is probably the thing that people want to know about, what do they do? And we're going to call Kevin Reilly in just a second to ask him for more information about this. Kevin Reilly is the spokesman for the Guam Fire Department. If you think you have been exposed to COVID-19 and develop a fever and symptoms such as cough or difficulty breathing, do not attempt to go directly to the doctor unless it is an emergency. Once again, if you believe you have these symptoms, or if you have these symptoms and you think you have COVID-19, do not go directly to your healthcare provider unless it is an emergency. Instead, call your healthcare provider, your doctor, your clinic, whatever, in advance for medical advice. Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed COVID-19 cases. The following symptoms appear 2 to 14 days after exposure. So this is not the symptoms appear after a 14-day is asymptomatic period. It is between 2 and 14 days after exposure. And these are the symptoms: fever, cough, and shortness of breath. If sick, stay home. Do not go to work, school, or public areas, and avoid using public transportation, ride sharing, or taxis. Do not entertain visitors in your household or visit others. This is so important, people. This is personal responsibility that can help save everybody else. And I know people like to kiss and hug and shake hands and all that stuff, but if you're presenting with symptoms, don't do that because it's selfish. Honest to God, it's selfish. That's just as much as we can say. It's either selfish or it's ignorant, and I understand people may be in some sort of panic or have some anxiety about this, but the responsible thing to do is to keep your distance from others. If sick, do not share dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people or pets in your home. Oh, my pets. And that's the information. Thank you, Janela Carrera from the governor's office, for providing that. That was at 3 a.m. Those guys have been up. I don't think they've gone to sleep. You saw it in the governor's eyes. She was bloodshot. That woman has not slept. And it has been quite a weekend for our governor and for the men and women conducting the emergency response. Let's try Kevin Reilly with Guam Fire Department to ask questions about what to do when you're presenting with symptoms when you're very sick? Oh, never mind. We got a message in from Dr. Shieh. Sorry, Kevin. But we want to hear from Dr. Shieh more.
Hello, Dr. Shieh.
Hi, Dr. Shieh. This is Troy, and you're on live with Kandit Land.
Yeah, I have 5 minutes.
Okay, Dr. Shieh, what do you want to tell us about this virus? What do you want to tell us about how people can stay virus-free or deal with infection if they have it? And also your thoughts on the government's response on this.
Well, I think we're already behind the ballgame. I think last month, I mentioned that I think that the virus is already on Guam. They're just waiting for the confirmation. And certainly, all of a sudden, 3 cases just sprung up just like that.
Yeah.
One of the cases is actually evidence of a community spread because that person never traveled. So he's caught it from somebody who has traveled and came back and gave it to that particular person. So that's very concerning. I think, I put on my Facebook that we need to quarantine the entire island. And I may be taking a step farther, but I don't mind being criticized for taking overly cautious plan. Because if you really think about it, we are at war, okay? And we know the enemy. The enemy is the virus.
Yes.
The gates are open. The gates are open for this enemy to come right through, and that's the gate of the sky. So we need to shut down that gate. The reason why I say that is because even Dr. Fauci, the world's most famous infectious disease person, said it yesterday. He said that we need to blunt the curve because the curve and the infection is exponentially rising. And the way to blunt the curve, yes, social distancing, closing up schools, etc., those will help. But we have to stop the virus from keep coming in. 2 weeks, that's all I think it's going to need to take to slow down this curve and keep going up. If we can blunt the curve and allow us 2 weeks to recover, let the people who got infected on Guam, let them recover. And then we can certainly sit down and evaluate the overall plan because the plan that we set in place, it didn't work.
Yeah.
And we knew it didn't. We knew it didn't work. Troy, you knew it didn't work.
Yeah.
Because we knew the flights coming in from those countries already have escalated, exponentially rising viral infection is coming in. And we know that it's going to get here. And we talked to the administration, we talked to public health about that. They listen, but I don't think they really care. They just do what they want to do. But they talk about one thing, though. They talk about we have to protect our doctors. We have to protect our nurses. Okay?
Mm.
If they say that, but do they mean that? If they mean that, they quarantine the entire island. 2 weeks. Let's all of us suck it up. I can't travel for 2 weeks. I can't see my grandson for 2 weeks. I suck it up. Okay?
Yeah.
And that's a big thing for me. Family is big. We all want to make sure that we're safe. But we have to close that gate. 2 weeks. Let us recover, manage the current infection. We don't have enough supplies. We don't have enough doctors. We don't have enough nurses. Governor said it herself. You cannot allow these viruses to keep flying in. Okay? We got to close that gate.
Mm-hmm.
The reason I say that also is this. The reason is this. Guam is small. Okay? We can get infected. This infection can spread like wildfire.
Yeah.
And for all we know, it's already out there. Troy, you could be infected yourself. You could be a carrier. In fact, Fauci actually is saying the new data that's coming out is that the young people are infected, but the carriers is spreading it to the older people. So
Yeah.
we need to have a lockdown. And I encourage the governor or the powers that be to lock down. You say, well, I can't declare a lockdown because we're not at war. I'm sorry, but Troy, we are at war. We are at a biological warfare against the virus.
Yeah.
If you don't recognize that, I'm sorry, but, the leadership is blinded by something else because maybe I think we need to really talk to them, blunt this curve and lock down. And let us healthcare workers be out there fighting this virus of what we have out there right now. Like, you keep bringing in new viruses. We're going to keep getting new infections. We got to stop that.
Doc, is the leadership listening to what the doctors are saying on this?
But they're not listening to me. I don't know who's their advisor. All the press conferences, you see the doctors standing with them? I don't think so.
No, there are none.
Oh. Troy, I've been on Guam for 23, 24 years. And you know me, I'm pretty, I speak my mind. You know, I don't work for GMH. I don't work for GRMC. I don't work for Guam. So, you know, I'm speaking out. But other doctors may be a little shy. But let me tell you, last night I didn't sleep at all because I got over 50 texts from my colleagues in the community that they're worried about this crisis.
Yeah.
We got to shut down. You want to protect the doctors, protect the nurses, shut down. Have a community, learn from Italy, learn from other countries. Shutting down is going to help. Let's overreact. It's okay. Let's be safe.
Thank you, Dr. Shieh. Appreciate it very much. You're at work right now, aren't you?
I am. Taking a break to talk to you because you're bugging me. So I talk to you. It's okay. You can share my message to the community.
Yes.
You know, if the administration doesn't give me a venue to talk, you know, of course I put it on my Facebook so I can inform everybody. They can share it however they want. I'm just being truthful that I'm on the front lines like everybody else. And I was just at GMH this morning. I put on my mask, and I'm heading back to clinic, and I need to see what we're going to do because it's just myself in the entire clinic, so I need to stay healthy. If you got to stay healthy, Troy, do whatever you can to stay healthy. Don't go out, stay home. Don't go out. Abstinence. I would encourage the governor to lock down. Lock down.
Thank you, Doc. We'll pass that message along to the Joint Information Center when we call them in just a second.
Yeah. Great. Stop the spread and lock down, okay?
Thank you so much, Dr. Shieh. Thank you.
Bye-bye.
Bye. That was Dr. Tom Shieh, outspoken advocate for health and for justice on this island. He messaged me this morning. He says, as I put in this mask at 5:30 a.m. and head into GMH to care for my patients, please pray for me and my fellow healthcare colleagues as I have prayed for all of you. Keep us safe and pray for our families as we distance ourselves from them. Please ask our governor and the powers that be to lock down and quarantine Guam. We don't have enough doctors and nurses or the equipment. We need to stop all incoming new viruses to Guam. Let us recover and manage for 2 weeks. We need to stop the spread and blunt this infectious curve, something that he just talked to us about. We are at war. Our enemy is the virus. The gates are open and we need to close it now to stop further virus from coming in. 2 weeks, no flights, quarantine Guam, is what Dr. Shieh says. Let's call Kevin Reilly now and see if he answers so that we have more information for you on what to do if you're presenting with symptoms. Hi, Kevin. This is Troy Torres. Hi, Kevin. You're on live with me with Kandit, and our viewers want to know what did they do if, let's say, they have a fever and they have symptoms of COVID-19 and they want to call an ambulance? First of all, is that something that they should do? And what happens after that?
Okay, so our dispatch, we're giving protocols for handling patients that call in with the symptoms, like you said. What the caller needs to do is provide that information to dispatch. They're going to be asked questions whether or not they traveled or they've been in contact with people that have traveled.
So you're going to do sort of like a triage with dispatch.
Correct.
Okay.
Yes, absolutely. That's exactly what it is. It's just additional information. Including the information that we already asked. This is just additional information to provide our guys with whether or not they should be prepared to enter, a house or a situation where it's required to have that.
So this is an extra precaution or protection for the medics who you guys need all to be healthy, correct? So that
yes,
if they are going to pick up someone, they're wearing their proper protective gear. Is that correct?
That is correct.
Okay, go on. I'm sorry to interrupt.
And there's simple questions. No, you're right on. There's simple questions about travel or contact with persons who have been traveling. Your exact symptoms. If you have a fever, and our guys are going to be there and they're going to ask you to put a mask on yourself. They're going to be wearing the proper PPE, and then they're going to. The communications, the biggest part is relaying that information to GMH also so that they can be prepared to receive that patient.
Are you guys going to, based on the answers that people give during this triage over the phone, are you guys going to refuse to pick up people and present them to Guam Memorial Hospital?
No, we do not refuse. It's just for our guys' protection to enhance their level of PPE that they're going to use.
Okay, so I know you mentioned the travel question a bit, and Dr. Tom Shieh, we just got off the phone with him. He raised a good point. He said 2 of the 3 who were confirmed did travel, but 1 did not, which means there was a local community spread. So is travel? I mean, is that such a big issue now?
So right now for us it still is, and I don't have all the information that they're patient, but whether or not they did travel or were in contact with people that travel. But like you said, as it develops, it's going to change. You know, it's going to change because it's going to be that local spread. We're still asking that question now, but every time a CDC comes out with a recommendation, those triage questions change, and ours will as well. It's going to be dynamic.
Kevin, is there a lower threshold for testing of your guys, seeing as how, you know, even mild symptoms might be an indication of something and you don't want things to spread? And so I guess my question is, are you guys testing more regularly for COVID-19 in case mild symptoms are presented?
Right now, we are not testing our guys. If their symptoms occur, we're gonna treat them just like a patient also, and have them quarantined. But right now, no. Our method, honestly, our method of prevention is their instruction and their training on the proper wearing of PPE. If they come in contact with somebody outside a workplace, you know, it is just as risky as coming in contact with one when they're on duty. So when they're on duty and responding, you know, we definitely want to be able to test them, but, you know, with the limited testing and test kits that we do have on Guam. However, yes, our main method of prevention is their training and their use of the PPE on all scenes that require it.
Do you guys have enough PPE for the next 2 weeks anticipated?
Currently, we have received more PPE from public health, and depending on how this, you know, we can't forecast exactly how much we need, but we are continuing to order more, to get more, and to receive more from other agencies. Okay,
awesome. Thank you so much, Kevin, for your time. Is there anything that you wanted to add?
Hopefully, you know, we just maintain that social distancing as the governor has been talking about, and practice proper hygiene. That's the most important. Hand washing, you know, keeping away. And I don't think, you know, we should be, we're taking the necessary precautions, but I don't, you know, there's no need to panic. Remember when you're hoarding, you know, all the supplies for yourself, remember that elderly person that's not getting the supply, that needs it probably more than you, if, like, you know, yourself who's healthy, who doesn't have any underlying conditions. Remember that, you know, we're a community. We need to help each other. We've been through this before. Our people are resilient. You know, I always say, you know, being from Guam, we're warriors. You know, we've been fighting ever since, you know, so let's just remember that. Take care of everybody else. At the same time, we're taking ourselves, and we'll get through this just like we have every other instance.
Oh, Kevin, you know what? Thank you for bringing up that hoarding thing, because I've got a question. I know this is probably like trite, but what is with the toilet tissue? Is that something that is...
I have no idea.
Oh, okay. So that's not any medical thing.
I guess people are saying that if, you know, you're confined to your house, but, you know, I mean, between us, you're in a bathroom, and there's other, you know...
You're talking about hashtag Tabo.
Wash your dog with people.
Hashtag Tabo, or whatever it's called.
I have no idea, honestly, what that's about. But...
All right, thanks, Kevin. Thank you so much.
All right, no problem.
I appreciate your time. Thank you. I just touched I have to touch the other side of my nose. I'm ridiculous. That was Kevin Reilly, spokesman for the Guam Fire Department, talking to us about what happens when you have some symptoms and you call 911 because maybe you want to get to the hospital. They will not refuse to take you to the hospital. What they're going to do, they've got this new system where they triage you over the phone, meaning they ask you a bunch of questions to determine how they're going to respond to you. So they ask you about your travel history, where you've been, all this stuff, right? So that their medics know whether when they pick you up at your home or wherever it is that you're at, how to be prepared with their protective gear and how to take you to Guam Memorial Hospital. Did he only say GMH and not GRMC? I don't think he ever said GRMC, right?
You know what? I'm not sure.
Maybe that's something that we can ask. But let's see if there's any more new information from the Joint Information Center. Hi, this is Troy Torres with Kandit News. Do you guys have a latest holding statement?
Let me go ahead and connect you to our PIO.
Thank you.
1 second.
Thank you. Vanessa Marie Leongro says Dr. Lombard also put out the same message that Dr. Shieh put out. Nesnes says Kevin Reilly's. Hello? Hello, hello?
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 Hi, yes. Can I give you the number? Because it's not transferring right now.
Is it 478-0208?
Yes.
Okay, thanks.
Thank you.
Those guys sound like they have not slept all night. Okay, they're not answering right now. They're probably being bombarded with information or with questions from here, there, and everywhere. You did hear that they are going to... I keep touching my face. That they're going to establish a hotline. Oh, I shaved. I shaved this morning. Son of a gun. They're going to establish a hotline. And they haven't sent out that hotline number yet, but we'll see. I'm trying to find this news release that came out from Saipan last night. We reported last night that the public school system in the CNMI is going to be shut down for at least from today, Monday, March 16, to Wednesday, March 18, until further notice. And then they're going to make an assessment as to what to do after that. And then we reported out a note from Governor Ralph Torres to his fishing group about how there are certain departments and services that will be shutting down in the CNMI. Before going to sleep last night, someone did send me information from the governor's office in the CNMI about a shutdown. I'm trying to find it right now. I can't remember who sent it to me. My WhatsApp is like all blown up. Hang on, let me just go to this. And then after we bring you news about that, we do have more COVID-19 news related to Congressman Mike St. Nicholas. Governor Ralph Torres. Oh, Ralph D.O.G. Torres. Okay. 9 hours ago, Governor Ralph Torres released the following. He says, in consultation with the presiding officers of the legislature and the COVID-19 task force, Lieutenant Governor Palacios and I are hereby shutting down all government offices and non-essential government functions. All non-essential employees of the Commonwealth departments and agencies are asked to stay home until further notice. We will provide additional updates on the government tomorrow. Please stay tuned to media partners and your department and agency heads for updates. There you have it. And this was all coming from an emergency meeting held last night by the Commonwealth government following news by Governor Lulian Guerrero that there were 3 confirmed cases on Guam. Now, Congressman Mike Nicholas issued the following news release. He says, for the 2-week period from March 16 to March 30, the political campaign of Congressman Nicholas will be halting all physical campaign activities in order to reduce person-to-person social interactions as part of coronavirus containment. He says, quote, every little bit helps during this time, and we need to showcase by example how important it is for us to manage as best as possible our ability to disrupt coronavirus transmission. A concerted effort by all of our people to interdict spread, even for a concentrated 2-week period, will save lives and help responders get in front of this. So let's all figure out ways to do our part. I'm so glad that he raised this issue, because if I see anyone campaigning on the roads, I will lose my schnizzle and be live quick as possible about whatever politician is taking advantage of this situation. So Congressman Nicholas, right on. Thank you for having some sense and sensibility. For a 2-week period, he is shutting down his campaign. This is the same in line with the recommendation that Dr. Shieh and apparently Dr. Lombard are making to our government, and that is shut things down for 2 weeks. Give everything a chance to sort of resuscitate into, the non-transmission of the virus in our community. You know what? Let's try. Oh, Letitia Lujan says, praying for your son, because Nesnes says, my son has severe asthma. Saturday, he was being a normal 6-year-old. Then he started coughing uncontrollably and almost blacked out. The medics were so kind, but please supply them with the proper and effective gear. Oh my gosh, prayers for your son. I'm so sorry, Nesnes. I hope everything is okay. Jacob Nakamura says, very concerning that the doctors are saying they are asking for their patients who are showing symptoms to be tested, but DPHSS is telling them no. You know, that is a concern, and we'll try later on today to get more information on that. Tioni Dominic says, 14 shut down, close the gates now, agreeing with Dr. Shieh. Jacob Nakamura, this is probably a story that we'll bring you later today. One of the coronavirus patients was very critical in ICU as of last night. Again, our hearts and prayers go out to those 3 and to anyone else who may be infected for a speedy recovery, and that for a full recovery, because we've seen the reports about lung function following recovery. Let's see if we can get, hold on. Hi, Pali Mike.
Good morning.
Good morning. This is Troy, your faithful parishioner.
Hey, how are you?
I'm great, sir. Thank you for taking my call. You know, our viewers want to know, the governor at around 2 a.m. said that she's canceling all large gatherings of 100 people or more, and this time she included religious groups. Is the Archdiocese of Agana going to be issuing any directive today to its parishioners?
We did not get that. Can you send that to me?
Yes, sir. I will send that to you. Also, we wanted to know about Catholic schools.
Yes. Catholic schools are closed.
Is it for 2 weeks or until further notice?
Until further notice.
Okay, so Catholic schools are closed until further notice. Are the weekday masses still happening as far as you know?
Yes, as far as we know, Archbishop will be giving his statement by 12 noon today.
By 12 noon today. Okay, we'll watch out for that. If you guys could be so kind to pass that on to us so we can pass it on to our viewers as well.
Yes,
and someone told us yesterday that the Archbishop is in Manila. Is that correct?
Archbishop returned this morning at 3:30.
Okay, and he's okay and everything?
He is, but I believe he'll be doing self-quarantine.
Oh my goodness. Okay.
But I'll confirm all of that by this morning, mid-morning. I have a meeting with him.
Okay, our prayers to the Archbishop and everyone else in the Archdiocese. First, you know, especially since he has to do self-quarantine. Why is Mount Carmel... I'm sorry, say it again?
No, just text that to me, the document about including religious events.
Yes, sir. One of our viewers is asking, why is Mount Carmel only closed for 2 days?
Yeah, that's the question we want to ask Mount Carmel as well.
Okay. Okay. Thank you, Polly Mike. So we'll stand by for the update at noon.
Okay, thank you.
Okay, thank you. Good morning.
Bye-bye.
That was Father Mike Crisostomo, the pastor of St. Anthony, one of the leaders of their special task force on COVID-19 for the Archdiocese. We're going to get more information from them at around noon. They were unaware of the governor's 2 a.m. order. It's still early in the morning. This just happened a few hours ago, and it happened in the middle of the night. But she included religious groups in the cancellation of large gatherings. So he's going to get together with Archbishop Burns mid-morning. The Archbishop just returned from Manila. He's in a self-imposed quarantine, I guess, except for his top advisors. And they'll be issuing a statement sometime around noon. Jacob Nakamura saying public health and GovGuam need to fully engage with the doctors who are active on the front line. They should not be cut out and kept in the dark. Could not agree with you more. Bill Hernandez says Dr. Tom Shieh has been posting way before it all. Yes, at least 2 weeks isolation for the whole island. OGNG says it seems like there is some big agenda behind the coronavirus. The easiest way to control the population is to put them through fear. Thank you, Rosa Kiliana, love. Thank you so much. And Jacob says, so the Archdiocese is going to be talking to Mike Phillips. Yeah, I thought that was pretty funny. Father Mike was like, yeah, we want to know that too. I don't have any other information. I don't have anyone else to call. I mean, let me just check my email to see if there's anything new that came in. Otherwise, we're good for at least now. Do you guys have any questions? Any questions? Now's the time. Jacob keeps saying, if you are sick, stay home. Yes, that's yes. Actually, even if you're not sick, if you don't have to go anywhere, stay home. That's probably one of the more important messages today. Even if you aren't sick, okay? Because who knows? You could be a healthy person. You could be sick. You're just not showing symptoms of it. And maybe you never will because your immune system is all good and fine. But what about other people who you come into contact with who don't have such a strong immune system? Stay home. If you really don't have to go anywhere, stay home. For Kandit News for this morning, good morning. Oh, I'm sorry. I just got something new. Sorry. It is from the legislature. At the very top of this memo from Speaker Barnes, Vice Speaker Nelson, Senator Regine Lee, and Senator Tello Tadagui, the minority leader, it says, transmitted via electronic mail in bold underline. They want everyone to know they're practicing social distancing. Hoffaday colleagues, based on the governor's declaration of a public health emergency with 3 locally confirmed cases of COVID-19 effective immediately, our offices are implementing the following changes in order to minimize risks associated with this communicable disease. They probably read all the news reports about the Parliament of Iran, and they're like, no, not going to happen here. The legislature has implemented a 14-day suspension of non-essential operations effective today, Monday, March 16. The executive director will advise central employees if they are required to report to work. The local transmission of the coronavirus requires quick action to limit its spread and save lives. To that end, the legislature is prepared to bring itself into session at the call of the Speaker to help with Guam's ongoing response efforts and to aid our people affected by the economic downturn the virus is causing on Guam. So thank you to the Guam legislature for passing that information along. Jacob Nakamura says, true, she can't control the flights, but she can when it arrives and order quarantine of everyone, then the flights will stop. There must have been a question about, Bill Hernandez says the flights, the governor said she doesn't have control. Is that right? Yes, that's right. The governor cannot tell the FAA what to do, but what the governor can do is defy the federal government by closing down the airport. She can tell Tom Matter to close down the airport, or she can, as Jacob Nakamura said, quarantine everybody who gets off those flights. That is within her local authority and jurisdiction. Will the governor do that? I don't know. As of now, no, the answer is no. For Kandit News, I'm Troy Torres. Until we get more information, we'll come back live when we do, but have a good day until then.